So the APHINITY study is actually the last study that was missing to evaluate the activity of pertuzumab in breast cancer, in HER2-positive breast cancer. We have data from the metastatic disease, we have data from the neoadjuvant setting where pertuzumab is highly active, and now the APHINITY study reports on the adjuvant use of pertuzumab in addition to trastuzumab and chemotherapy. The study met its primary objective, so it's a positive study showing that pertuzumab can reduce the number or the frequency of invasive disease events. There's an absolute improvement by 1% only, but the relative risk reduction is 19%, so the hazard ratio was 0.81. The question, of course, is this clinically meaningful? And there we have to consider first, it's an early outread of the study. We know that still in subsequent years there will be more relapses, and usually the relative risk reduction remains the same, whereas the absolute risk reductions will become larger. Second, the APHINITY population is a very broad one, including 1/3 of node-negative disease and also 2/3 of patients with hormone receptor positive patients. And we can mainly see the effect in patients with node-positive disease and hormone receptor negative disease. There, the risk reduction, the relative risk reduction is about 23%, so larger, but still also there the absolute benefit is only around 1.6, 1.8%. So to me, the trial first makes me much more confident that when we use pertuzumab in the neoadjuvant setting, where it's already approved, that this will be of a maintained benefit for the patients with some kind of survival benefit. There will be, of course, patients that will not be treated in the neoadjuvant setting, but still have sufficient risk factors to support the recommendation of pertuzumab as adjuvant treatment. But also there will be quite a substantial number of patients with low risk HER2-positive breast cancer, where we probably won't need pertuzumab because the general prognosis of these patients is nowadays so good that it's very difficult to further improve this. And as we know, every treatment has some kind of side effects, and this has to be taken into the equation, and therefore it's probably not worthwhile not reasonable to treat the very low risk patients with an additional and also somehow costly treatment.